Hi, I am doing two things here. First, I just got a webcam and I am trying it out, so bear with me. I haven't been able to use it, so I thought I should give it a shot. And then I wanted to just speak out on behalf of rare diseases, of course. I know that I say a lot and make posts a lot on Facebook about it, and it probably can get annoying, but that is not my intention. My intention is to draw awareness to rare diseases because the research is not there for rare diseases. For example, one of the diseases that I deal with is called Klippel-Feil syndrome. And Klippel-Feil syndrome is a disease that you are born with. It's congenital. You have any vertebrae in your neck fused together from the time you're developed. And so in that happening, you, in my case, I did not know of it. There were certain things growing up that I noticed I could not do, or I noticed that I couldn't look down well, and I could not do a somersault well. And that is because if you have 7 vertebrae in your neck, which you do, and in my case, I have 3 of those fused together from birth, then that makes it a little hard for you to do certain things. But, you know, I've had that my whole life not knowing. But the issue varies from person to person. There are several anomalies or associated conditions with Klippel-Feil syndrome that can involve any one of your organs. It can involve your mobility. Your neck can be fused completely from birth. You have a low hairline because those bones were all fused as they developed, and so they everything is kind of crunched together, and so your neck seems shorter, and you can also have webbing in your neck because the neck is so fused together that everything kind of just comes together. Um, you In my case, I did have the low hairline, and it was always something that bothered me, and now it made perfect sense when I actually was reading after I had my x-ray. I was having terrible neck pain, and I had an x-ray, and it just, I looked it up. I looked up fused vertebrae, and I basically diagnosed myself the night before I went to my orthopedic, and it made sense for me because I always had that low hairline and didn't know why. Um, but basically, when you have a rare disease, the funds are not there because the numbers of people aren't there. So the research and funding goes to diseases that are larger, and meaning more people have that disease. So the people who have a rare disease, and this is things that are congenital, so from birth, you know, babies are in need of treatment, and the funding is just not there. So the parents are searching for treatment and answers and a path to follow. And Klippel-Feil right now really doesn't have a path to follow. There are definitely um, places for infants to get treatment and have a game plan, but it's not a course of life treatment, meaning when you reach a certain age, that treatment drops off. And I can't tell you how many doctors I've been to that they've never seen a patient with Klippel-Feil. They don't understand it. I bring in the information, and so it's overlooked, and the issues and complexities of what is happening in your cervical spine, in your neck, they don't really know what is going on. And I'm often given kind of a brush off because what neurosurgeon wants to take me on? You know, I have as many people do. Now, some people with Klippel-Feil syndrome do not have pain symptoms, and they may have other symptoms. It's very individual. But for me personally, it is hitting my nerves in my neck, and it is, I have stenosis. So the nerves are being smashed, and it causes all sorts of issues for me neurologically constantly. Dizziness, nauseousness, pain. I have extreme head pain. It namely is in my forehead, but it can move to any area of my head. It can run through my neck down into, I kind of say it's like a cap that kind of stops here, but then it runs into my hands, and it runs through my face at any time. I can have extreme jaw pain, and these things are common for adults, but as adults we don't have the treatment. So I'm after, and the group that I'm forming, and we're working as a team, it's not me forming it. We're definitely open to anyone wanting to participate. It's open, it's for us, it's our advocacy group. That's the aim right now, and we're working on it. It's going to be a nonprofit group that we're shooting for a course of life treatment, and that doctors know what Klippel-Feil is, and they know the complexities of it. And you know what? It may not happen in my lifetime, but babies are born with this every, you know, every few days. It's rare, but you need a plan, and you need places to go, and we need lists of what doctors to see, and we need, you have to have all of your organs looked at and checked out, and you need those resources. And right now we go it alone, and each patient tries to figure out and navigate a plan. So I don't mean to ramble. Just as a side note, I also have von Willebrand disease, which is a bleeding disorder. And as a woman, that has been fun. And I take 2 medications every day so that I'm not bleeding. And that has been something I've dealt with. And I kind of have it under control for now. But if I have a cut, it just bleeds and bleeds. It's always fun because I usually cut myself in a professional meeting, and I've been known to carry Band-Aids everywhere. The other disease that I have, which is also a rare disease, is leukocytoclastic vasculitis, and I'm actually seeing a rheumatologist tomorrow for that. But it again is rare, and even rheumatologists, I just saw one 3 weeks ago, and she had no clue what to do with me. But it causes your joints to swell, and you get blisters because the blood vessels are inflamed, and they just kind of, basically they fill up, and it's extremely painful. And I have it in my feet and in my legs and in my hands. And we're also going to be looking at, is it also, because it's your veins, and your veins are everywhere, it could be contributing to some of the head pain that I have. So we're looking into that. But anyway, we're going to fight, and please bear with me, and I hope I haven't bored you to death. I wasn't meaning to ramble, but I just wish everyone the best, and I just want you to know that we need to speak up, and we need to fight, and we need to get the word out, and that's the plan. So have a good afternoon. Thank you.